So friends, let's start today's session. So in today's session I will be discussing regarding most important high yielding topics for NEET PG, INICET, FMG, whatsoever it is, and that subject is surgery, right? You know, right? Surgery is very important, and it's one of the biggest major biggest major topics oriented subjects, right? It is factual also and it is conceptual also. So make sure that you're going to do all your concepts well at the same time. So today I will be discussing regarding all the important classifications in surgery. So we will start, okay, and let's dive in now. Okay, let's start. I'll not be covering all the classifications. I think I may miss here and there few classification. Please forgive me, but I am going to cover at least the most important classifications which are very much necessary for your exams. Okay, first thing is the modified Johnson's classification. It is used for gastric ulcers basically. So how is it done is you're going to see different places and they're going to give the names. Grade 1 is if it is in the lesser curvature. Grade 2 is if it is having at the junction of gastric plus duodenal. Okay, and the grade 4 is at the gastroesophageal junction, and the grade 5 is drug induced. Okay, these are the things you're going to know. And next is the forest classification. In the forest classification, it is again, sorry, I think I missed your grade 3, right? I missed grade 3. Yes, I missed grade 3. Sorry, here. Write down. Grade 3 is pre-pyloric. Okay, sorry. Pre-pyloric is grade 3. Okay, grade 3 is pre-pyloric. Next is forest classification. In the forest classification, again, it is for endoscopically scoring for gastric ulcer. Okay, again, what does it tell about? It tells about one is risk of bleeding, second is what intervention is needed for this particular thing. The next one is Glasgow classification. Again, I have told you it's a Batchford scoring. Okay, Glasgow classification which a Batchford score. If they can give both names. What is it? Again, it is endoscopically scoring or the gastric ulcer needed for the treatment. Just the treatment part is focused here. Okay, next, going on to the Stewart's classification. It is used for the adenocarcinoma of the stomach. What does it tell you? If you're going to take the gastroesophageal junction as the reference, that is 0, if any of the cancers of the stomach, if they're varying from +1 centimeter to +5 centimeters, got it, in this range it is called as esophageal. Okay, the next one is if any of things which are going from in between, okay, that is +1 to -2. Sorry, I have written +2 here. It is -2. It is -2. Okay, then next is the subcardial. In the subcardial, it is from the -2 to -5. Okay, -2 to -5. So friends, sorry for the interruption. So here please see it properly. What I have told you is +5, +1 to +5. This range will be esophageal. Got it? The second one is in between, that is +1 to -1, that is below, so it is minus. Okay, that is real cardiac. If it is -2 to -5, it is subcardial. Got it? Take the gastroesophageal junction as the reference. There is one more thing called as Borman's classification, which is used for endoscopically characterizing the ulcer, and here the fourth grading is very famous, that is Linitis plastica. Next, going to the Lawrence classification. In the Lawrence classification, we have intestinal type and the diffuse type. In the intestinal type, again, it is the most common. Here it is less common. Got it? It is more common in elderly, it is more common in young people. It has better prognosis, it has bad prognosis. Here it is associated, or the risk factor is H. pylori infection. Here it is family history and the blood group A people. I don't know for what reason. Okay, then hematogenous spread and lymphatic spread. Okay, remember the diffuse is not having the diffuse spread, that is hematogenous, it is opposite. Okay, that is lymphatic spread, whereas intestinal, it is not intestinal, it is diffuse. Okay, don't get confused, just remember diffused is not diffused, that is not hematogenous. Simple. Okay, it's opposite. Here one more thing you are going to remember is the mutation. Here it is APC MPS mutation, here it is the loss of E-cadherin. Okay, then coming to the Tokyo's classification, it is for acute cholecystitis. Okay, again it has 3 types: mild, moderate and severe. Remember only 2, rest all you can keep it for moderate. Okay, not more than that. Take the total leukocyte count less than 18k, it is mild. Okay, if you have any of the organ failures, then it is severe, that is altered senses, decrease in the BP, hypotension, increase in the serum creat, decrease in the platelets, and SpO2 is decreased. All such things are indicating organ failure leading to the severe acute cholecystitis. Okay, next important thing is the Bismuth-Strasberg classification, which is used for the CBD injury, CBD duct injury or the stricture. Okay, see here properly. If you're going to see the leak in the cystic duct, okay, see here, you're going to see the cystic duct stump leak. Okay, cystic duct stump leak, then it is type 1. If it is right sectorial, see it is right sectorial, see here it is the right sectorial duct ligation. Okay, it is ligated. Okay, it is ligated, whereas here you see right sectorial. Okay, sorry, right sectorial transection. Transection means cut. Okay, here it is ligated, here it is transected. Remember, in fourth it is lateral injury to the CBD. See here the lateral injury. Okay, this is the lateral injury caused to the CBD. Fifth one is depending upon the hilum, how far it is the duct injury is. If it is more than 2 centimeter, then it is E1. Okay, if it is more than 2 centimeter, if it is less than 2 centimeter, then it is E2 from the hilum. Okay, don't forget. See here, this is what the defect or stricture. Next is at hilum, at the hilum itself. See, this is the hilum, this is the hilum. At the hilum itself it is done, but the hilum is intact. See, it is normal, right? It is completely looking normal, so it is E3. If the hilum is distorted, see the distorted hilum here, right? The hilum is distorted, that is E4. Right and left both are involved now. See, the right is also involved, left is also involved with the duct stricture. Okay, the duct stricture is also visible for you, right? That is E5. It is bit complicated, and repeated enforcement into your brain will lead to the memorization of this stuff. Okay, don't forget to revise it properly. Not that all the classifications are such way only. Trodanis classification. In the Trodanis classification, where we are going to see regarding the choledochal cyst. Okay, choledochal cyst, right? In the choledochal cyst, what and all you're going to invest, that is very important. One is type 1 is fusiform. See the fusiform dilatation, what I have marked in yellow color, right? That is fusiform dilatation of either the common hepatic duct or the common bile duct. Type 2, it is diverticulum formation leading in the common bile duct or common hepatic duct. Okay, one more is type 3, choledochal seal, that is something obstructing, that is intramural part of the CBD here is in the duodenum is dilated. Okay, in the duodenum it is dilated at the part of the duodenum. Type 4 is extra plus intra biliary dilatation. Type 5 is intrahepatic alone. Okay, it is also called as Caroli's disease. Don't forget. I think this classification is very familiar for you people, right? Next, coming to the one more important classification, that is Japanese Anglo-Saxon classification. It is used for biliary atresia. Okay, what does it say? See, in the type 1 it is saying that type 1 is only CBD, common bile duct fibrosis. Type 2 is common hepatic duct fibrosis. In type 2b you're going to see common bile duct, common hepatic duct and gallbladder. Everything is fibrosed. For the sorry part is see the type 3, which is the most common, where you're going to see the whole biliary apparatus is having fibrosis. Sorry for the patient. Next, Tigaro classification. I think you have heard this, right? It is used for chronic pancreatitis. Based on the causes, you're going to differentiate based on causes. Remember, based on causes. So what are the causes? T is for toxic metabolites, which is given in the I think SRB and the standard Balian law is the cassava, some of the toxic metabolites. Then I is for idiopathic, G is for genetic such as pink gene mutation, A is for autoimmunity, R is for recurrence, and O is for obstructive causes. Okay, these are the things to be remembered. Next, coming to the hydrated classification, again it is very important. One is Gergi classification, other is WHO classification. Only two things you're going to remember here. Okay, WHO is always good, right? It is very standard. So 2 is honeycombing and 3 is water lily. We do follow this only. Okay, most probably we are going to follow this. Many of the hospitals follow this grading only. Okay, but Gargi, it is Indian, right? So they might have slipped away, right? So they have done ulta. Type 2 is water lily, type 3 is honeycombing. It's exactly opposite for WHO. Just make sure that you remember them. Next is Parkes classification. In the Parkes classification, you're going to see fistula and ano types, how where and all the fistula and ano has occurred, whether it is extrasphincteric or suprasphincteric or intersphincteric or transsphincteric or submucosal, right? That is important. Next is Bosniak classification. In the Bosniak classification, what does it tell? It tells about the treatment chart. Okay, it tells about the treatment chart of the cystic renal masses. Where it tells if it is type 1 and 2, you're going to just do the follow-up. If it is type 3 or 4, you're going to exercise that particular renal mass. Okay. Next is IPSS classification. It is used for BPH. Here again the score is important. 0 to 7 it is mild, moderate is 8 to 19, severe is 20 to 35. Okay, this is the scores. If it is mild, you're going to do wait and watch. If it is 8 to 19, you're going to give tamsulosin and dutasteride. If it is 20 to 35, very severe, we are going to do the surgery in case of acute or chronic retention of urine with any of the complications present. Okay, next we are going to do the Bethesda classification. In the Bethesda classification, you're going to do the thyroid needle. You're going to stage the thyroid needle, right? This is also very, very important and very commonly asked the Viva question, right? One is inconclusive, 2 is benign, 3 is ATP of unknown significance, right? 4 is follicular, 5 is suspicion, 6 is confirmed. Simple. If you remember the starting letters, it is easy. Okay, what you're going to do and all I've written, you can just refer to it. Okay, next is 15. The one is the European classification regarding the hernia. Okay, hernia has two classifications, just to mention now. One is primary classification, the recurrent classification, that is the European classification. Here again, first they are going to see whether it is direct hernia or indirect hernia or femoral hernia. They have given a tag for it. L is for lateral, M is for medial, F is for femoral. As you know that indirect hernia is always lateral. You know, they are going to take the reference of that artery, that is the superior or superior. I think inferior, sorry, I don't remember properly. I think inferior one is taken as the reference, and based on that they are going to grade it. Next, they are going to give the numbers. 0 is for no hernia detected, 1 is the defect. What and all they tell, that is important, they tell about the defect. Okay, they tell about the defect here. Less than 1.5 centimeter is 1 finger, that is 1. 2 is for 2 fingers, 3 is for more than 2 fingers, that is 3 centimeter, right? If it is not investigated, then it is X, not X. Okay, sorry, X. 16, one you're going to see is the EHS classification, that is for incisional hernia. This also you might have heard, right? If it is again midline and lateral, again two types. In the midline you're going to see this one. M1 is subxiphoid, M2 is epigastric, M3 is umbilicus, M4 is infraumbilical, M5 is suprapubic. How we are going to do this? Take the umbilicus as reference and keep it in the center, that you have 5 types. In the center in it is umbilicus, so M3. 2 above it, 2 below it. Okay, you can easily do it, right? Lateral, in the lateral it is subcostal, flank, iliac and lumbar, right? L1, L2, L3, L4. Remember how it is subcostal, very near to ribs, right? The next is flanks, right? Then go back to the iliac, then it is lumbar. Okay, very from far to near. Okay, they are coming inside. Okay, they are coming medially, from lateral to medial wise. Okay, next is DeBakey's classification. Since age is from the pathology classes, very, very important. Aortic dissection. Okay, this is the older classification, where type 1 is involving both ascending and descending. Type 2 is only ascending. Type 3 is only descending. Stanford, the updated classification nowadays, which is used for the aortic dissection. What is it? Type A, that is 1 plus 2 of the DeBakey's is ascending plus descending. 3 is type B, that is only descending. See, suppose this is the arch of aorta. You are going to remember that after it gives the branches, that is BCS, right? That is Budd-Chiari syndrome. What ma'am had told, very famous mnemonic which is going on viral, right? The ascending and the descending thing. Okay, there you are going to divide. till the give branches it is ascending, after giving branches it is descending. CEAP classification, very important since your surgery times, which is used for the varicose vein, and it is the C type, that is the clinical thing. E is for etiological, A is for anatomical, P is for pathological. But here you're going to concentrate more on the C, because most of the times in the PYQs or the PYTs you're going to remember that the CEAP classification is most commonly restricted to the C type, that is the clinical oriented types of the varicose veins. Okay, what does it say? C1 is telangiectasia, C1 is telangiectasia, C2 is varicose vein, C2R is recurrent varicose vein, C3 is edema, C4A is eczema, C4B very important, all these three very important. C4B is lipodermatosclerosis, C4C is corona phlebitica, C5 is healed, C6 is active venous ulcer. Okay, whereas C6R is recurrent active venous ulcer. Okay, I think this might have helped you. Please do share, like and subscribe, and please stay tuned for the next upcoming classes such as criterias or the scales, gradings, all such I'll keep discussing in the next future classes day by day. Make sure that you're going to watch these videos in the last 10 days of your revision schedules, okay, not in the early stage, because these are all the volatile stuff, you can't remember all the things, right? So make sure that you're going to do it in the last part of your preparations. Thank you guys, bye.